Ethical and policy factors in care coordination. Code of Ethics. Nurses have had a responsibility to perform with an ethical practicing manner long before the American Nursing Association, ANA, formally adopted the Code of Nursing Ethics. These codes comprise of 9 provisions that was last updated in 2015 to reflect the changes in healthcare and current practice. The first 4 provisions discuss nurses' duties and responsibilities towards their patients. They address the importance to consider social and economical status while being mindful of personal attributes. They address the nurse's need for compassion, commitment to all patients, and their responsibility to protect and advocate for their patients. It also addresses the nurse's responsibility for their own actions and being accountable to provide best practice. Provisions 5 through 9, going into a little more detail about duties and best practice. These provisions discuss the responsibilities of a nurse to promote health and safety while maintaining professional and personal growth. Every aspect of their practice must inherit an ethical environment of quality care. It is important that professional standards of practice derive on evidence-based practice. In order to promote patient-centered care, the nurse must collaborate professionally while maintaining integrity and integrating principles of health, safety, and well-being of their patient. This presentation, we will be focusing on a couple of the provisions that specifically address the nurse's responsibility to promote a sense of safety for their patients. Provision 3, maintaining their ethical obligations to their patient. Provision 6, and promote and protect the human rights of the patient. The further focus would be on the lesbian, gay, bisexual, transgender, LGBT youth in our community. Specifically speaking, the organization that provides safe homes and health safety to homeless youth, lost and found youth, LNFY. This organization is a nonprofit organization that works with youth between the ages of 13 and 25 in the city of Atlanta. Their focus is to abolish homelessness for LGBT and plus community, as well as all other sexual minorities in the surrounding area. As the Affordable Care Act, Public Law 111-148, it is the law to make sure all patients are protected with care. They deserve improved health care and coverage for preventative services without discrimination in receiving the best quality of care. As in the name, insurance should be affordable for all. There should be no discrimination based on health history, birth, gender, and/or current coverage status. All individuals should have the right to fair pricing, coverage options, and tax credits. Nurses must provide continued support, education, and valuable evidence-based practice. The bottom line is there should be no discrimination of any kind in receiving healthcare coverage. The Affordable Care Act provisions, along with the Health Insurance Portability and Accountability Act, HIPAA, work together to protect patients' rights, as well as their health information. Continued violations of ACA sections need to be reported, and individuals in violations need to be held accountable. ACA sections that support violation are as follows. Section 1557, Health System Discrimination, talks about non-discriminative care being offered. Section 2702, Guaranteed Issues, meaning that we're guaranteed to address these issues to protect our community in non-discrimination. Section 1302, Essential Health Benefits, making sure that it is essential that all Americans receive proper health benefits and have access to them. Section 1311, Qualified Health Plan and Marketplace, meaning that they are getting the best options in the marketplace to have the best plan for their care. HIPAA is in place to protect patient information while promoting quality education and well-being of all patients. In the case of the LGBT community, ACA and HIPAA protects the individual seeking care and healing in the marketplace that is diverse and comprehensive in all their needs, without discrimination. Violations of HIPAA can be between $100 to $1.5 million per violation, depending on severity and repeat offenses for civil cases. Criminal cases can lead to similar fines of up to $100,000 and up to $10,000. Up to 10 years in prison. LNFY provides crisis support, simple healthcare awareness, and health dental referrals to youth in the community in need of support. They provide mental health support and counseling as well as free HIV/STD testing. As LGBT individuals are provided support, they are also provided with awareness of their rights and how to fight for them. LNFY, many times the LGBT community is turned away for services due to their sexual orientation. Based on the ACA, this is discrimination of the worst kind. They are entitled human rights and should not be turned away from services. As a volunteer for this organization, I do physicals and needs assessments prior to them seeing the counselor or nurse practitioner. There are many basic needs that are being denied just for basic well checks and dental checkups. ACA states no discrimination of any kind regardless of pre-existing conditions. Transgender youth are starting their process at an earlier age than before. And now many health organizations are underhandedly discriminating care based on original gender bias. According to HIPAA, it is an individual's right to restrict certain history that reveals birth gender if it is not necessary for healthcare services. Violations can result in fines over $50,000 per violation, as well as up to 5 years in jail. This is just another way that the government influences policies and health safety that interferes with coordination of care. When individuals are denied care, they are discouraged from seeking care that is needed, causing a minor concern to become a major concern once finally evaluated. As a nurse and advocate for all patients, we have to recognize our own bias and unconditionally provide culturally congruent care, all while advocating for the LGBT community. We as nurses have to remove disparities and discrimination in healthcare that is judged off sexual orientation or gender identity. The LGBT community already has many obstacles and stigmas of inequality that they face on a daily basis, and receiving proper health care shouldn't be one of them. Regardless of the laws and provisions that are enforced at the state and local level, providers continue to show discrimination to the LGBT community. As a result, delays in care and health disparities continue. It is our job to provide patient protection. As an advocate for all patients, it is our duty to condemn discrimination and prevent interference with a patient's self-determination, as well as access to much-needed services. Nurses' scope of practice provides compassionate and respectful care with a nurse-patient relationship that protects human rights. In order to act in the best interest of the patient, we must advocate and provide equal access to services and resources without prejudice. It is important for all nurses to provide safe, exclusive, and ethical, competent care. In continued protection, we must be mindful of demographics that are collected as we perform best practice that identifies sexual orientation and other patient data that could be in violation of HIPAA. We also provide protection to our patients with continued education and research in how to be culturally aware and knowledgeable in how to incorporate this awareness in our everyday activities. Acceptability, accessibility, and accountability. It is well understood that sexual orientation remains a social determinant in healthcare in the LGBT community. Regardless of gender identity, this minority group has the right to non-discrimination and equal rights to healthcare without barriers. However, in studies as recent as 2017, patients continue to be discriminated against. Discrimination such as not making health services available, providers refusing to provide care, imposing judgment on LGBT patients, and making no effort to obtain proper resources for LGBT patients, causing poor care outcomes. It is our job in the nursing profession to be accepting to all patients and provide acceptable patient-centered care at all times. It is our job as nurses to advocate for all patients to receive accessible healthcare services without discrimination. It is also most important for all healthcare providers to be non-discriminative or be held accountable for their negative actions. Provisions for healthcare outreach. Many resources are available to advocate for the LGBT community to bypass some of the disparities and obstacles that they often face. There are mobile applications that provide resources and referrals for much needed but non-accessible care. With outreach services, nurses are able to advocate and protect personal boundaries and protect patients in a professional capacity. They are able to direct identifiable information and maintain confidentiality and assist with foreseeable ethical challenges. We in the nursing profession must continuously research to find a better understanding in addressing potential conflicts. We must create a better outreach avenue for the LGBT community that is equivalent to all patients. These methods uphold the standards of patient care, promote the policies of ACA, and protect their health information with the standards of HIPAA. Tying it all together for ethical support and wrapping things up. In conclusion, as we have discussed, there are policies, laws, and procedures in place to protect the LGBT community as they reach out to healthcare providers for services. It is our job as healthcare professionals, namely nurses, to research and educate ourselves on the ethical factors and methods needed to support the LGBT community. In doing so, we ensure better handling of challenges and better care being given as well as being received. It promotes best practice of patient-centered care as well as increases healthcare skills to better handle ethical issues without hindering care being provided to the LGBT community. In order to have significant, sustainable, successful impact on the LGBT community, CEUs, activities, and training on healthcare needs, services, resources, and barriers is a must. Thank you.